joining the club. Okay.
All right. Excellent. So my name is Alex Weigard, and my colleague, Dr. Cynthia Burton, and I are both really excited to talk to you all tonight about the impacts of COVID-19 on mental health, both in terms of impacts that have occurred kind of throughout the history of the pandemic, and then also kind of what we can expect going forward, and also what we can do about it. So first thing, I'm going to try and just give a quick overview about what we're going to be talking about today. First, we're going to introduce ourselves and talk a little bit about our work and how it's relevant to some of the stuff that we're going to talk about tonight. Then we're going to introduce the concept of pandemic stress and talk about how the COVID-19 pandemic in particular has had some negative impacts on multiple mental health related topics. So both, we're going to talk about kind of general impacts on emotional and behavioral health. I'm going to spend a little bit of time talking about the impacts on individuals with attention deficit hyperactivity disorder and learning problems, and then spend a little time talking about the impact of COVID-19 on substance use and substance use disorders. Then lastly, we're going to talk about some skills and strategies that we can use to try and address some of these impacts. And then lastly, we'd be really happy to answer any questions that anybody at the meeting has. So also I will say that we can make this, especially with a smallish group like this, we can make it a little bit informal, where if anybody has any questions throughout the presentation, please feel free to interrupt us or put them in the chat, and we'll try and kind of address them as we go along. So first, to just kind of introduce myself, a little bit about me. I'm a clinical psychologist and neuroscientist at the Addiction Center at Michigan Medicine. I grew up and lived in Pennsylvania until I moved here. I got my PhD from Penn State University, and now I'm really happy to be a Michigander. I really like the cool weather, especially like over the past couple of days here. And so for work, I primarily work in research at Michigan Medicine, and I use computational modeling and brain imaging to study cognitive processes in ADHD and substance use disorders. So when I tell people about what I study, sometimes people are kind of surprised that I study these two different topics because they can seem kind of different. But it turns out that there's a pretty large amount of overlap in the brain processes that seem to be relevant to both of these conditions. And so those are the processes that I'm really interested in. So today I'm going to talk about some of the challenges that people with ADHD and learning problems have faced throughout the pandemic, and also talk about how substance use has been impacted by COVID-19. And I'll let Dr. Burton take it away.
All right, thanks. Hi, everybody. Thanks for being here and joining us tonight. So a little bit about me. I'm a neuropsychologist, which means I'm a clinical psychologist, and then I have specialty training in neuropsychology at Michigan Medicine. I'm from California originally, went to college and grad school there. I'm also now happy to be a Michigander. I do like winter. I will go on record saying I like the winter. I just wish it were a little bit shorter. In my clinical world, I use cognitive tests to describe a person's strengths and weaknesses and be able to make recommendations to them, their family members or care providers, their physicians, things like that. I also study something called cognitive remediation or cognitive training, cognitive rehabilitation. These are a group of behavioral treatments to improve thinking and everyday skills for people who have cognitive difficulties. So today I'm going to be focusing on some of the challenges that people with mental health conditions have faced during COVID. Okay, so I think we can all agree it has been a year and then some, not just in terms of the actual time that has passed that we've all been experiencing this pandemic, but in the magnitude of what we've been experiencing. So this professor in California, I think, put it really nicely, describing how the past year has been very difficult for most people. The US population and worldwide has confronted a series of what she calls cascading collective traumas, starting with the pandemic and followed by all sorts of additional factors. We've learned that the pandemic has not affected all people evenly, and that some communities of color have been hit with the greatest rates of illness and death, and also uneven access to the vaccine. So she really stresses that there's no one size fits all response to the pandemic and these collective traumas that have followed. And I'll say, whatever it is that you have experienced, whether it's rage, whether it's binge watching things on Netflix, whether it's needing to escape to your bathroom for some time alone, it's all okay and it's all valid. And we're all trying to struggle through this together. So one thing that's sort of interesting is to think about, the waves of impact of this health crisis, right? This is a worldwide public health crisis. And so if you think about the health footprint of COVID-19 sort of on the up and down axis there over time. So the first wave that we were all experiencing sort of in the spring of last year was this first wave, the immediate mortality and morbidity of the illness, right? Bed availability at hospitals, shortages of respirators and ventilators. And then there's a tail sort of in the post-ICU recovery. The second wave, which came a little bit later and maybe wasn't quite as high of a footprint, was the impact of resource restriction on urgent non-COVID conditions. So for people who experienced a heart attack, for people who experienced a stroke or a brain injury or a mental health exacerbation and couldn't access the resources that they needed. As we move along in time, a third wave, this sort of bump along the bottom, considers the impact of interrupted care on chronic conditions. So for people who had difficulty refilling prescriptions or getting into their primary care doctor's office to manage these ongoing health concerns. What you'll notice though is that the first, second, and third wave tend to tail off and minimize over time. What's really concerning for us as mental health professionals is this fourth wave, right? Where we're seeing a massive increase and one that's likely to stick around in terms of what they've called psychic trauma, mental illness, this economic injury, and burnout that everyone is facing. So this is really where we're likely to be landed for quite some time. So if we think back to around this time last year, right, in the spring and summer of 2020, there were a lot of very acute COVID-19 stressors. You probably recall very well. So some of them surrounded fears about the virus and the illness itself, right? Will I get sick? Will I contract this illness? Will my loved ones get sick? Will I die? Will somebody that I know die? Somebody that I love and care about? How many Lysol wipes do I need to use on my groceries when I come home? Is it okay for me to go to the drugstore? Can I hug my parent or my child? In addition to these very serious and grave concerns about the virus itself, we all experienced these massive disruptions in our routines, right? For humans and for creatures who really crave routine and structure, this was a huge upheaval, right? Shifting to work from home or losing a job altogether, school shutdowns, daycare closures, quarantine, lockdown, stay-at-home orders, the list goes on and on. Nothing was normal about life during COVID. Nothing is normal about life during COVID. Not to mention the social isolation, right? For people who live alone, for people who don't live alone, not being able to get out and about, not being able to interact with loved ones, friends, family members in the way that we're very accustomed to was a huge stressor. There's also factors including unemployment, people who lost their jobs or people who risked serious illness to be able to go to their jobs, economic losses and the continued fallout from that. And then finally, the uncertainty about the future, right? How long will this go on? When will I be able to fill in the blank? When will things be normal? What is normal? Will it ever be normal again? Right? These were all very acute, very serious stressors that we've all been facing over the past year plus. We have been able to identify some protective factors, right? So for people who describe higher levels of social support, they tend to fare a little bit better, right? They have more of a buffer to sort of manage some of those risk factors or those stressors. For people who have financial stability and steady employment, for people who were able to transition to work from home rather than losing their job entirely, people who had that flexibility. People who were able to access healthcare resources or have a workplace that was safe. People who were able to find adequate personal protective equipment and not have to go out into the world risking transmission or infection, and being able to access timely COVID testing once that was available. So in the context of all of these stressors, right, it would not surprise anybody that people really worldwide, these are data for the US, but worldwide have been experiencing increased mental health symptoms in relation to the pandemic. So this was a web-based survey from the Centers for Disease Control and Prevention from August of last year. So it's almost a year old now, this data. But they surveyed about 5,000 people and asked, who was experiencing some of these symptoms or these sorts of disorders. And I think it was about 40%, so almost half of the respondents endorsed some kind of adverse mental health or behavioral effect related to the pandemic. Anxiety or depression were among the top, so about a third of people almost were endorsing symptoms of anxiety or depression. Trauma and stress-related disorders were also pretty high as well, over a quarter of respondents, as well as increased rates of substance use and even serious suicidal ideation. These are concerning, obviously, for anyone who works in the mental health field or is experiencing a mental health condition or has a loved one who's experiencing these symptoms as well. So I was looking into some of the research about the effects of pandemics on existing mental health conditions. So there was this interesting study that I wanted to tell you about. This was published in the past year. So this was a meta-analysis. That's a special kind of analysis where you group together lots of data that have been reported by different research groups, and you expose them to the same analysis to give you good, strong data. So this was 15 studies that were conducted during pandemics. You'll see that most of them were COVID, but a couple SARS and a couple from an influenza pandemic across several countries worldwide. And they found that people with pre-existing mental health diagnoses had significantly higher anxiety and depression, but interestingly not psychosis, during a pandemic compared to those without these pre-existing mental health conditions. At the same time, there was a reduction in psychiatric hospitalizations and utilization of mental health services during the pandemic. That's not great. If people are experiencing an exacerbation or an increase in symptoms, but for whatever reasons, probably related to the pandemic, not able to access care, that creates longer term ongoing problems and more serious problems. Another thing to think about are mental health conditions and risk for COVID and vice versa. So this was a very interesting study looking at what they called the bidirectional relationships of mental health conditions and risk for COVID. So they were able to access electronic health records for almost 70 million people in the United States, including over 62,000 people who had a COVID diagnosis. And their analyses found that having a psychiatric diagnosis in the previous year, so again, this sort of pre-existing mental health condition, was associated with a 65% increased risk of a COVID diagnosis. So this risk was independent of known physical health risk factors. They were able to account for things like diabetes, things like hypertension, and these underlying health conditions that would have been part of the health record. They couldn't, however, exclude certain socioeconomic or lifestyle factors that wouldn't have been captured in the data. So for example, things like smoking or a sedentary lifestyle. So it's possible that there's just common things amongst people who have mental health conditions, also have some of these other factors that make them more at risk for COVID. But nevertheless, people who have mental health diagnoses are certainly at increased risk for contracting COVID. The relationship goes the other way as well. So in patients who had no previous psychiatric history, a diagnosis of COVID was associated with double the risk of a first-time psychiatric diagnosis in the 2 weeks to about 3 months post-COVID, compared with 6 other non-COVID health conditions. So for example, they compared people who had COVID to people who had flu or kidney stones or broke a bone, and found that there was double the risk of a first onset mental health condition, most commonly anxiety, insomnia, which makes a lot of sense, and interestingly, dementia, more so than mood disorder or psychosis. All right, we're going to move on.
All right, yeah. So now I'm going to just talk a little bit about some specific implications of specific challenges that folks with attention deficit hyperactivity disorder might be facing throughout the pandemic. So ADHD is considered a neurodevelopmental condition that's characterized by difficulties with paying attention and with impulsivity that cause impairment with everyday tasks. So everybody experiences some difficulty paying attention sometimes or acts impulsively. But basically the difference is that folks with ADHD seem to have these behaviors to the extent that they cause considerable difficulties with day-to-day life. So ADHD is kind of a unique disorder in some ways in that it's often diagnosed in an academic setting and diagnosed in childhood. So typically it's about 10% of children, about school-age children, around school age have been diagnosed with ADHD. But one thing that's only become acknowledged more recently is that ADHD is also fairly common in adults. So about 4 or 5% of adults continue to experience ADHD symptoms as they grow older, and they can continue to cause impairment. It's often related to other learning problems such as reading disability. And another thing that's important to keep in mind that is only kind of recently starting to become acknowledged is that even though it can cause, we often think of it as causing impairment in academic settings like in the classroom, but it can also be really impairing in work settings. And this becomes a particular problem with adults who continue to experience those symptoms. So when we think about the impact of COVID on individuals with ADHD, it's important to keep in mind the broader context. And that is that in response to COVID, there's been a really historic transition almost overnight from face-to-face instruction in the classroom to remote learning. So this is something that schools and colleges did by necessity, basically. There was really no other way to continue education, once the pandemic really started to increase in severity. And it's had really profound effects. So even for students without learning problems, remote learning does appear to be less efficient. So individuals who are basically across the board people seem to have a harder time learning remotely, and it takes them longer to learn the same things that they would have learned if they would have already been in the classroom. And it's important to keep in mind that the impact appears to actually be the worst for students who were already struggling and already falling behind. So that includes people with learning disabilities and struggles with mental health disorders, and also people with lower resources. So if you look at the chart on the right by McKinsey, which is a consulting company, they did a study where they tried to quantify the amount of months of learning that people have lost during the pandemic, as opposed to if they had been able to attend in-person instruction throughout the whole time. And they basically found that there's a pretty significant impact overall. So they're estimating that people have lost about 7 months of learning relative to if they had been in the classroom. But it's important to point out that this is not distributed equally. So people of certain racial or ethnic minority backgrounds seem to be disproportionately affected to lose more months of learning. And what's really stark is that people with lower financial resources, so kids from lower income households, seem to actually lose over a year. So this is a really significant setback. And it's especially significant for folks who were already kind of struggling in the first place.
Alex, there's a question in the chat that says, do the ADHD slides also pertain to those with ADD, or are they specific to those with the hyperactivity aspect?
That's a great question. Yeah, so these are basically pertain to both individuals with ADHD and who have the hyperactivity aspect. So the thing that's kind of interesting about the subtypes of ADHD is that they are dissociable. Like some people show symptoms of hyperactivity and others don't, but they don't seem to be stable across time, which means that if you take a kid who has just ADD early on, it's fairly likely that if you then test them later on that they might not just have ADD, but might show symptoms of hyperactivity. And so because of that, there seems to be a lot of agreement now that the subtypes have pretty similar implications in terms of impairment, and they seem to not to kind of change across the lifespan, if that makes sense. So this pertains to just anybody with the diagnosis. Any other questions before I move on?
Thank you for asking that one, Leon. You beat me to it.
Thank you.
Yeah, great. All right, so it's important to keep in mind then that students with ADHD, although they exhibit academic difficulties, a lot of these difficulties can be addressed by a structured environment. And what I mean by that is an environment where there is a very clear schedule of learning activities, and also where people are getting pretty frequent feedback from teachers and other educational instructors. And so individualized educational plans, or IEPs, can be really helpful with that. So they're basically plans that help increase the level of structure for kids with this disorder and can really help them learn more. So as you can imagine, when you pull somebody out of a classroom, especially somebody who might have an IEP that gives them more structure for learning throughout the day, and put them in a remote learning setting, which is much less structured, you're probably going to experience a lot of difficulties. So this was just one study that I found where they looked at parents of adolescents, some of whom had ADHD and or an IEP to deal with ADHD, and others who did not have ADHD. And what they found is that overall, most people reported at least a little bit of difficulty with the transition to remote learning. Like I said, across the board, this was kind of a difficult transition for people to make. But if you look at parents of kids with the disorder, you found that basically half or sometimes over half of people are reporting a lot of difficulty transitioning to a different learning environment. And this was often reported to be due to the fact that they're just not able to have the same structure and not able to focus as well in the home environment where there are more distractions. So this kind of disproportionate impact is really important for people with this diagnosis. Something that I also wanted to mention, consistent with the idea that ADHD has been found to impair performance at work in addition to academic performance, is that there's been another historic shift to work from home for a lot of people who have jobs where that's possible. And so you can imagine that similar to difficulties faced by students who are transitioning to remote learning, people who are, particularly adults who are transitioning to remote work, are also probably going to encounter more difficulties at home. So there's a lot less structure in the home environment. And there's also a lot more distractions, right? There's, you don't necessarily have somebody, you're not interacting with people who are giving you feedback that much. You might have, a TV, your phone, things around you that are going to distract you, or you might have kids at home. So this is a real challenge for everybody. And I know from experience, my wife and I had a daughter in October, right before the winter pandemic surge this year. And it was, I thought I'd be able to concentrate and do a little bit of work at home. And I found out pretty quickly that I couldn't really do much at all. So this is really challenging, and it's probably going to be especially challenging for somebody who already has difficulty paying attention. So it's important to note that as work from home and this kind of hybrid work models where people work from home part of the time become more commonplace in the workplace, we have to think about how to address ADHD symptoms in workers. This is going to be an ongoing discussion. And so the bottom line is that COVID-19 has caused substantial disruptions to learning and to people's careers, right? If people are struggling with working from home, they might not be being promoted. They might not be meeting milestones that they need to if they're struggling. And this is particularly true with people with ADHD and learning problems and other pre-existing disadvantages. And these disruptions are going to be felt for years to come. So this is just kind of a sobering effect of the pandemic that we're going to have to continue to deal with, one of those lagged effects that Dr. Burton was talking about. And so what can we do about it? So we want to think about how we can do more and better accommodations for students or workers who struggle with attention problems. As always, we want to try and reduce stigma and encourage treatment seeking. So there are a lot of, contrary to, popular belief that medication is, the only way to treat attention problems, there are a lot of different options that work for different people. And so we want to encourage people to explore those options to find something that works for them. And then, as I was saying, we want to start to acknowledge or better acknowledge that ADHD symptoms in adults can impact their ability to perform in the workplace, and try and come up with strategies for dealing with those issues. All right, so lastly, I'm going to focus on the impact of COVID, specifically on substance use disorders. So substance use disorders, which can involve a wide variety of substances from alcohol, illegal drugs to prescription drugs, are all sort of characterized by compulsive seeking of alcohol or drugs, despite the harmful consequences that are caused by use of the substances. And so if we're talking about substance use disorders, biggest issues, at least in this country, has been what's called the opioid crisis, which I'm sure most folks on this call might have already heard of. So this is basically the fact that over the past decade or so, there's been a really profound increase in initially in the rates of people using prescription opioids. So things like OxyContin and Vicodin or hydrocodone. And as the years went on, this seemed to spill over more into folks who started to have substance use disorders related to opioids, started to spill more into the use of illegal opioids like heroin and stuff that can be found on the street. And so basically over the past decade, this has led to a really strong and really tragic increase in overdose deaths. And so it's received a lot of national attention, and rightly so. So even though that's received a lot of attention, it's also important to keep in mind that in some ways alcohol, even though it's more commonly used, is kind of not as, it's often not thought of as a drug because it's legal and it's pretty normative to use alcohol in our society. Alcohol actually in some ways has a larger public health impact. So if you add up all the deaths that are related to alcohol overdose, alcohol related health problems like liver disease and accidents, it actually appears to cause about twice as many deaths annually. So those are the two issues related to substance use disorders, at least in this country, that seem to have the biggest public health impact. And so you can kind of summarize the effects of COVID-19 on alcohol use, or on substance use and substance use disorders. There are basically three things to highlight. One is an unfortunate setback in our fight against the opioid crisis. So as I said, use of opioids and rates of overdoses related to opioids have been gradually, have actually been fairly quickly increasing over the past decade. In the years immediately before the COVID-19 pandemic, it seemed like there was a kind of a slight slowdown. So there were still a lot of people who were using opioids relative to other historical periods, but the rate of growth seemed to be slowing a little bit. And as you can see from the chart on the left, that was CDC data basically of overdoses related to opioids and other drugs. COVID-19 seemed to have really been a major setback in this. So there was a really large rate of growth from 2019 into 2020, particularly in the use of fentanyl, which is a very strong synthetic opioid and related drugs. And then you see a corresponding really strong increase in overdose deaths. So this is a national trend, but you can also see it here in Michigan at the local level. So what I'm showing on the right is actually data that was compiled by the University of Michigan Injury Prevention Center. And they looked at records of naloxone use by EMTs. So naloxone is sort of an antidote to opioids that you can administer to somebody who's experiencing an overdose and oftentimes save their life. And they found that there was about a 29% increase across the state in use of naloxone by EMTs in 2020 relative to 2019. And they also found a 15% increase in suspected opioid overdose deaths. So you can see how the national pattern is being played out across the state, and particularly in those red counties that are shown in the maps. Another pattern was that for a lot of common substances, and particularly alcohol, people just across the board seem to increase to some extent their rate of use. So people's rates of use of what are called party drugs, so these are drugs that people tend to use in groups or at parties, right? Like cocaine and MDMA or ecstasy actually decrease. As you can imagine, as people were more isolated, they use less of these substances. But use of alcohol in particular, which is often used in the company of other people, but can be used when people are alone as well. It's also very common. Actually tend to be used even more. So this seems like in some ways a kind of an understandable reaction to the stressors of the pandemic and the social isolation that's caused by the pandemic. You see more people drinking more often and drinking alone. There's been a lot of concern about this because where alcohol use increases at a societal level, you often see negative after effects following in terms of rates of alcohol use disorder. And in particular, there's at least one study that talked about the possibility of an aftershock in alcohol-related liver disease. So this is something that we might be another kind of lagged effect that we might be dealing with as the result of COVID for a long time. And then finally, as Dr. Burton mentioned, for in parallel to people not being able to actually access treatment as much for kind of general mental health concerns, the exact same pattern has sort of played out in treatment for substance use disorders. So residential programs in particular have faced major impacts. It's very hard to figure out a way to safely socially distance folks who are actually in residential programs, which are common for people who are really struggling with a drug or alcohol use disorder. And then it's just become more challenging to give regular care to people who have substance use disorders, right? We've had to really change a lot about how we do that in terms of transitioning from in-person to virtual care, and the transition hasn't always been great. So this is another big issue, is people aren't getting the care that they were beforehand. So to kind of sum up, substance use disorders and their consequences do appear to have worsened as a result of COVID, in part due to just kind of this general increase in stress and isolation that might lead to greater use of opioids, alcohol, and other drugs. And this is also similar to the effect of the pandemic on kind of general mental health conditions. Another thing is related to the kind of bidirectional relationships that Dr. Burton was talking about, is you also find that people who have substance use disorders are more likely to contract and more likely to die from COVID-19. So we know that there are a lot of physical health risk factors like hypertension and obesity that are related to risk of dying from COVID. It turns out that substance use disorders are actually a substantial risk. That could be for a lot of reasons that we don't yet understand. But again, there's this kind of bidirectional relationship where suds actually can actually impact the pandemic. So because of that, in terms of what we can do going forward, is we want to continue acknowledging substance use disorders as a public health priority, both on their own and in the way that they intersect with COVID, because we're going to be dealing with COVID probably for at least the next couple of years as vaccines come out and variants come out. We have to keep in mind that mental health and substance use kind of interacts with COVID in really important ways. We have to explore new methods of treatment delivery that can be done socially distanced. And last of all, and this is what we're going to spend a lot of the rest of the talk talking about, we want to find ways both at a societal level and in our personal lives to kind of better manage stress and trauma, because stress, trauma, and the social isolation that's come with recent events is really, really strongly related to people using substances as it's related to other mental health issues.
Thank you. We'll let you take a breath. So for a little bit of silver lining here, right? The world maybe has never experienced COVID-19 before, but the world has experienced pandemics. And to the extent that this is a collective trauma, similar to the quote I shared right at the beginning, one of the things that we know from an extensive body of trauma research is that most people respond with resilience, or what we think of as bouncing back from adversity. So the vast majority of people, despite all of the stressors with COVID, despite all of these negative mental health outcomes, most people will be able to experience resilience, or sort of that bouncing back. We certainly need better screening methods for people who are at the greatest risk, for the people who are least likely to experience resilience, identifying those folks and being able to help them access treatment. And the idea to phase in treatment, so identifying, perhaps there are some people who need a much lower level of care, perhaps some time-limited support, just to, to have a shoulder to cry on or an ear to bounce ideas off of and to kind of process some of the stress. Moving into, for people who are still experiencing distress or symptoms, moving into more structured therapies or treatments that are more comprehensive, things like that. So we want to be thinking about that in the back of our minds, right? We want to be promoting resilience, promoting these protective factors. So how might we do that? So one thing we're going to talk about for most of the rest of our time together is something called the stress continuum model. It's also sort of adapted from this idea of stress first aid, or SFA. And the stress first aid model really is a self-care and sort of peer support model that was originally developed for people in high-risk occupations. So for people in the military, fire and rescue, law enforcement, to be able to recognize the reactions to sometimes catastrophic events and sometimes not so catastrophic events, and to be able to respond to them in a supportive way. So we recognize that stress responses lie along a spectrum of severity, and everyone will react when faced with a severe enough or an extended enough stress. And really lots of different factors can affect how that person might respond and recover. So if we think about this spectrum, right, this sort of continuum, here on the far left, we have the awesome zone that most of us are never really in for any extended period of time, but we'd like to be. This is the aspirational green zone of optimal wellness, right? Getting into the yellow, a person might experience sort of mild or transient symptoms, right? This is where a lot of us are living this year, right? You might notice feeling a little bit more irritable, a little bit more anxious, a little more difficulty staying motivated, some interference with sleep, but again, mild and transient. Moving into the orange and the red are more serious, right? In the orange, symptoms become more severe, they become a little bit more persistent, right? So that at that point, we're thinking about things like panic, anger problems, serious depression, guilt, shame, blame, things like that. And into the red is really sort of the danger zone, as exemplified by its color, right? This is where symptoms become persistent and they become disabling. This is where they're interfering with a person's daily life, interfering with work, interfering with relationships. They cause severe distress and that loss of function and are oftentimes associated with hopelessness. So we can sort of think about, sampling our own stress reactions over the past year and maybe noticing stress reactions in others. A lot of us have been sort of moving along this continuum in a very reasonable way in response to the pandemic. So we can identify a few sort of risk factors for moving into the orange and the red, right? What are the things that might tip the scales a little bit and encourage this movement more into the danger zones? So experiencing a life-threatening event, right? If your life is on the line and you experience that sense of horror, that sense of helplessness, that sense of fear, that is much more likely to move a person into the orange and the red. Experiencing loss. So sometimes this is specifically loss, meaning death of a loved one, somebody that you care about, somebody that you feel responsible for. It could be a family member or a friend or a coworker. Experiencing inner conflict. So this comes up when our behavior doesn't necessarily match our sort of moral and ethical code. You might have heard about this a little bit with some of our frontline or healthcare workers during the COVID crisis, right? Where nurses and physicians and people who are on the floor in the trenches are having to make split-second life or death decisions. Does this patient or this patient get the ventilator? I know that one of them is going to die. That's not consistent with our moral and our ethical principles as health providers to save people and to do right by them as best we can. This could also be, for non-healthcare workers or non-frontline workers, behaving in a way that isn't necessarily consistent with your morals or your ethics. I really value seeing my family members, and I know that I'm putting them at risk for exposure or contraction of COVID by doing X, Y, and Z. Those things are sort of in conflict with each other. And then this idea of excessive wear and tear, you can tell that this comes from sort of a military language, right? Where this is sort of the cumulative stress of that daily grind or the cumulative parts of all of these different things going on in an enduring way. So those are the four things that we really tend to see when people are moving more into the orange and the red zones. So we're going to spend a little bit of time talking about some responses, right? Thinking about the 4 C's of stress first aid. They are to check, calm, connect, and coordinate. So when we're thinking about this movement, right? Yellow to orange to red and back again and back again. The first C, or check, is really increasing awareness about stress reactions in ourselves and in other people that we care about, and in an ongoing way. It's not a one and done, but sort of a continual check-in. So you'll see in the box here lots of different things, and maybe you're looking over it and recognizing a few for yourself. I know when I'm feeling stressed out, I eat a lot more and I just want to be by myself, right? I just kind of feel like I'm at my wit's end. I feel like I just need to sit on the couch, and it doesn't take a lot to sort of put me over the edge, right? So recognizing those sort of patterns in ourselves, looking over these things, wondering about, having trouble holding a conversation, not being able to think clearly, feeling overly busied, having physical changes in eating, weight, things like that. What are your own stress indicators, and what are the ones that you can notice in somebody else that you care about? So it's important to check yourself. It's also important to check on others, right? Some things to be thinking about, this can be a very uncomfortable scenario, a very uncomfortable way of trying to communicate. So it can be important to try to think about it in advance, to try to pick the right place and time to talk, right? Maybe that's a private setting. Maybe it's when you can devote a few minutes to a conversation. It can be a good idea to begin with something pretty casual, two-way communication or conversation, or maybe having a sense of how the other person prefers to communicate, right? Will they feel less defensive or feel less on the spot with a text message versus a direct phone call? And because this type of communication and this sort of check-in can be very uncomfortable, there's another acronym, because of course we love acronyms and have them all the time for all the things. You can think about trying Oscar communication. I meant to put a picture of Oscar the Grouch on here and I forgot. So Oscar communication is a way to sort of start the process of this check-in on other people, where it starts with an observation. So for example, it's been a hard time lately. How are you doing? Most people are going to say, I'm okay, right? The sort of knee-jerk reaction is to just brush it off, say things are fine. Yeah, I'm okay. The next part is to state your observations. What is it that's motivating you to ask that? What are the things that you've observed to make you concerned? Now, I just ask because I notice you've been keeping to yourself a lot more lately. You might want to clarify your role, right? Sort of diminishing that defensiveness or making sure that the other person understands that you're coming from a place of concern. I just thought I'd bring it up. I'm concerned and I want to know if there's any way that I can help. The A in Oscar communication is to ask why. So the person maybe at that point would feel open and could acknowledge, yeah, it has actually been really tough. I've been struggling quite a bit. You might ask why. Well, what's going on? Did something in particular happen? And finally, make a response, right? We want to let the other person know that we hear them, that we might experience a similar stressor, that it can be really hard and it can be really challenging what they're going through. So those are some strategies to check on yourself and to check on other people that you care about or that you're concerned about, to sort of help get a gauge of whether a person is sort of starting to trickle into orange and red, or whether we can sort of maintain the more optimal green and yellow.
All right, and so the second of the 4 C's stands for calm, and that basically means to try and find ways to reduce the stress that you're feeling. So stress occurs at both the emotional and behavioral level, and it also occurs at the physiological level in terms of how our body and our nervous system actually reacts to the stress that we're feeling. So there are a lot of different ways that we can try and reduce the intensity of stress at those different levels. So one of the most effective ways of reducing stress at the physiological level is to engage in physical activity. So things like exercise, yoga, stretching, and even things like deep breathing exercises have actually been shown in a lot of scientific studies to reduce stress responses in people's nervous systems, to actually reduce that physiological feeling of stress that you feel. This is another, this winter when it was really difficult, kind of having a young kid at home and being pretty isolated because of the pandemic, I basically had a rule that no matter how cold it was, my daughter Phoebe and I were going to suit up and go for a walk around the neighborhood every day. Just to have that like little bit of physical activity every day was really, really helpful for kind of keeping me balanced. Another thing you can do is spend time with family and friends, both just because it can be calming to just be in the presence of other people that you like to spend time with, but also let them know that what is calming for you ahead of time so that they can support you if you actually need help. Lastly, just to kind of give yourself a little bit of time every day to just do something that you enjoy, right? So we all have, very busy lives. There's a lot of things that we have to do, but it doesn't take much. Even taking 20 minutes, half an hour to just listen to music, take a walk, watch videos that we like, something that to have a little bit of time for ourselves actually goes a long way. So in terms of addressing stress in other people, there are a number of different things you can do. So you can explain what you've done to address similar reactions. So if somebody's really struggling, you can say, hey, you know what works for me? If you find time every day to go for a walk, if you do this breathing exercise, this is helpful, right? And in the process of doing that, you can empower and support other people to kind of help them deal with stress in their own lives. One thing that's important to keep in mind is that sometimes people might encounter, there's daily stress that people that can encounter, and there's also very, very large stressors like losing a loved one. So this is unfortunately something that a lot of us have experienced throughout the pandemic, right? And it's kind of a unique situation to deal with. So something that has come out of this work on the 4 C's is the idea that when somebody faces a significant stressor like a loss like that, sometimes it's really hard to know what to say, right? There's really not necessarily much you can say to make that event different, to make it better, right? Oftentimes just being there and being a supportive presence for that person, just listening and helping them grieve is really just what they need. So just try and be there for them. And there's a lot of ways that we can just do that and to help support other people when they really need it. So the 4th C is to connect, and this is basically aimed at restoring and increasing your level of social support. So like I said, just being around other people could be a stress reliever. It's really, really good to have a support system that you can talk to about issues you're dealing with, and then you can just kind of blow off steam when you're having a hard day. So in terms of self-care, it's really good to kind of seek out a support system, even if people are far away. So something that the pandemic has kind of normalized more is keeping in touch with people that we might not otherwise keep in touch with over video call, right? So even if it means just, over the phone, over Zoom, something like that, if you can set up a regular time to meet with your friends and family, people that you prioritize and that you enjoy spending time with, it can be really, really helpful. And then the other thing that's important to keep in mind with this is to have conversations with people that you know well enough to be able to tell you if they sense that something is bothering you, right? So people that you're comfortable, even if it's just 1 or 2 people that you have in your life that you're comfortable enough with each other that they can kind of recognize when you're not feeling right, it's important to spend time with those people. And then another thing to do in terms of connecting and helping other people. So in the same way that connecting with people can help you, it can also help other people. So just the act of caring for others and being there for people, keeping the line of communication open. If you know somebody's going through a different time, just checking in and saying, hey, we haven't talked in a week or 2. Why don't you drop me a line or we can meet. We can go for a walk together outside or something like that. That can be really, really powerful. So in the same way that keeping yourself engaged in social activities is really important, it's also really important to actively check in with other people, see how they're doing, and show that you care. And finally, so the last C in the 4 C stands for coordinate. So all of these strategies can be really helpful for dealing with stress on our own and with others. But we know that sometimes a higher level of support is needed, right? So you might actually want to seek out mental health resources or seek out mental health professionals if you or someone else actually needs a higher level of care. So it's important to become attuned and kind of trust your gut when you're thinking, you know what, this could be something that kind of needs something else than what I'm able to provide. So just remember to stay attuned to that.
Okay, so just to round out our conversation with a couple of other strategies, this is really just the hodgepodge of additional things that we thought might be helpful to highlight. One that I really like, especially in the context of the pandemic, is thinking about what we can control versus what we cannot control. So this little fox is encouraging us to think about the things inside the moon that we can control. That's our attitude. That's how well we as individuals follow CDC and other public health guidelines. Our own distancing, limiting social media or access to news that might be upsetting, finding fun things to do, things like that. And really acknowledging the things that are completely out of our control. If Costco is out of toilet paper for the 18th time, that is not in your control. Predicting what will happen being responsible for other people's health behaviors and whether they're following the rules, things like that. So I think this can be a really helpful framework in addition to the 4 C's and all the things that we've already talked about, and just acknowledging, you know, having control over what we can and acknowledging and letting go of the things that we can't. There was also sort of a nice, you know, three R's. If you need more letters in your stress first aid, thinking about relationships, routines, and resilience, right? If it comes down to just those 3 things, maintaining supportive relationships, maintaining routines, and building resilience in that way. So to come back to this idea that it's really been a year and then some, we've experienced these cascading collective traumas, like Dr. Cohen-Silver mentioned in the beginning. But she also made sure to point out that on the other hand, we also see that many people have been better able to appreciate time with their loved ones, to reprioritize relationships that are important, to focus on the fact that maybe we have had more time for leisure activities or felt more grateful for the things that we do have. As we move past this pandemic. And it's great that we have this talk today on the day that Michigan lifted all of our mask restrictions and things hopefully are returning to some degree of normalcy, whatever that looks like. As we move past the pandemic, the research really suggests that most people will be resilient and will come to appreciate coping strategies and strengths that they did not even realize that they had. So we wanted to include a few more resources. Early on in the pandemic, and Kat Bergman, who's here, was involved in putting together this massive toolbox of resources in our Department of Psychiatry, COVID-19 resources. So available at that link is all sorts of information for adults, for children, for a variety of mental health conditions and concerns. We included the link for the CDC Stress and Coping. FACE COVID, yet another acronym that relates to mindfulness practice and how to respond effectively to this crisis. Another sort of helpful framework on building resilience during the outbreak. It talks about sort of thinking about positive and negative things on a scale and what you can do to either remove some of the negative, add some of the positive, or move the tipping point with coping strategies. And that last link are some of the quotes from the experts, like that's where we pulled the Dr. Cohen-Silver quotes from. It's basically experts who have weighed in on their thoughts on the pandemic. With that, we will thank you for your time and your attention and open it up for questions and answers, whatever they may be. We've included, Dr. Weigard and I have included our contact information there. If you have any questions or if there's anything you want to follow up about, you're welcome to be in touch. Otherwise, thanks for your time and let's chat and discuss.